Infrastructure Investment and Jobs Act, also known as the IIJA, was recently passed in part to help reduce Medicare hematologic and oncologic drug waste. And the way it works is by having manufacturers reimburse Medicare for all medication over 10% that's wasted. Hi, my name is Xiao, and I am a third-year internal medicine resident at Mayo Clinic. And I'm very excited to talk about our article, Analysis of Medicare Expenditure for Discarded Infused Cancer Therapeutics from 2017 through 2020, which will appear in the Mayo Clinic Proceedings. Our study investigated if this IIJA were in place from 2017 to 2020, how much savings Medicare could have seen from it. And we found that it would have resulted in a median annual savings of about $172 million. And to put that in a more human perspective, this amount of wasted medication could have treated up to around 20,000 extra patients with this therapy. This waste was especially high for medications that used weight-based dosing or single-use vials. And we also looked into potential ways that manufacturers might try to get around the IIJA and find other ways to maintain profits even in the face of this act being passed. Our study revealed that almost 20,000 additional patients could have been treated with these wasted medications. But even for those patients who did receive treatment, the financial burden of drug waste was still likely passed on to them in the form of higher out-of-pocket expenses, especially for those without supplemental insurance. There's no doubt that this could probably impact their adherence to therapy and also increases the emotional toll of this sort of therapy. Patient advocates can call for more transparent pricing, explore alternative dosing strategies, and encourage conversations with providers in order to help their patients receive effective and cost-efficient treatment. We're hoping that this article can help contribute to ongoing conversations for reevaluating dosing strategies to minimize waste. Perhaps consideration could be made into investigating innovative methods to minimize drug waste, such as safer vial sharing, improved storage practices, which are not uncommon in other countries. Additionally, clinical practices should monitor and report drug waste more accurately, as we know that now there is significant underreporting of waste, which is affecting the ability to understand just how severe this problem is, and thereby ways to help address it. The next steps in this study would be to reconduct it in a few years now that the IIJA is in full action and to see the true impact that it has on drug waste. It will also be helpful to see different ways that manufacturers will adapt to it in these coming years and catalog those. Specific studies to more thoroughly analyze the difference in waste and cost between these different dosing strategies, such as weight-based and fixed-based dosing, would also be valuable, as well as also seeing if there are any outcomes difference between these dosing strategies. And finally, it would also be very helpful to evaluate what the patient's perspective and experiences are with this medication drug waste. In particular, research could explore how this waste affects them financially and emotionally, and whether or not it impacts their adherence to treatment plans.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.